This type of cases you are not seeing in your practice frequently. Sometimes I have met the homeopaths who had 20 or 30 years of practice, but they have never seen such patients. Because this is a disease for which the patients are coming and they only go to the surgery. First they could go to ANT surgeon and then they follow the surgery. Next slide. So this is, the topic is CSF or rhinorrhea or cerebrospinal fluid rhinorrhea. What happens, this CSF is getting fluid in your spinal, between the spinal cord and your brain, and sometimes it is getting leaked through the nose, which is called as CSF Rhinorrhea. There are two types of causes, acquired and congenital cause. In the acquired also there is traumatic, non-traumatic tumor. I have every type of the cases, which includes tumor and sometimes the pituitary tumor, sometimes the large brain tumors, and any factor which increases the undue CSF pressure can cause the CSF Rhinorrhea. Even I have seen the patients which has only mental stress and that is causing the CSF Rhinorrhea. So how to diagnose the condition? The patient is coming to you and sometimes you are seeing that they are telling you only unilateral discharge from the nose without the coryza. And if that discharge the patients are taking in the handkerchief, and if handkerchief is not getting stiff, because the mucin content which is coming through the nasal secretion make that content stiff, but the CSF doesn't contain the mucin. Another is the chemical diagnosis. There is one specific protein called as beta transferrin and beta trans protein. These you need to analyze from the lab, and the more specific diagnosis is the CT cisternography, in which a dye is injected in your spine, in the patient's spine, and they get the CT slices and the defect is getting detected. Unilateral discharge without coryza is more likely CSF. The CSF treatment, the medical treatment is very expensive treatment because it is done through the endoscopic nasal repair. In the endoscopic nasal repair, what happens? That some part of the thigh fat is getting stuck with the endoscope through your nose. But most of the times I have seen the patient, when they sneeze violently, this leak again started. So I am presenting, these are my patients. Can you see the number of the patients which I am getting from the different part of the country? These are the real time cases. Now the patients are different patients. You are seeing that CSF is getting, again see in the next slide. Can you see? They are presenting at my clinic. These are the type of cases I am getting at my clinic. And the most important rubric, because the CSF is a condition which was not recognized in earlier days, so our repertory and Medica doesn't mention anywhere. So I am taking this rubric hydrocephalus. What happens in the hydrocephalus if the child head is not fused? Then the head is getting enlarged with the CSF pressure. But in the adult, already the sutures are fused. So the most important rubric for the increase of the CSF pressure is hydrocephalus. So invariably I take in all spontaneous cases the rubric hydrocephalus. This is one of my model case number 1. And CT scan finding reveals a bony defect in the claviform. This gentleman from the Delhi banged his head towards a glass window. He didn't see that it was so transparent, and due to the injury, this case.
Hello, my name is Anupam Khurana. I live in Noida. I had a problem of CSF leak.
Due to the paucity of time, I am skipping the videos.
मैं बिल्कुल ठीक हूँ सर आपकी
got completely cured after 1 year. I have taken the follow-up. There are different follow-up.
2020 और अब 21 1.5 साल पौने 2 साल हो गया है.
And this is on 19th February 2022.
Then I went to Max Hospital Saket and
they
we were very clearly told it was easy surgery.
Very good. So this is a very recent case. She is a MBBS doctor. and she is suffering with this CSF Rhinorrhea. You can see the leak. This is the leak. You can see. And suspicious bony defect in the cribriform plate with 3.8 mm defect. And I have started treatment. Meanwhile, during the treatment, she got meningitis, obviously with allopathic medication. She got treated. Fortunately, she got checked, but the CSF was not checked. So I have started the treatment, and she is getting better.
ठीक है.
बिल्कुल. And she is saying that she is.
एक बार meningitis हुआ था बीच में, आपको पता ही है. Normal चल फिर तो रही हूँ घर पे यहाँ नीचे बहुत थोड़ी बहुत.
Household activities, and this is very recent follow-up under 20th.
So there is no
September when I was coming to this conference.
नहीं.
There is no CSF.
Today is 23rd September.
3 months.
And I think for 2 or 3 months you didn't observe any CSF leak.
No.
So this was the first case, and this was my first case. I am going to present this particular case. This was my first case of CSF Rhinorrhea, where there is a bony defect in the cribriform plate, leaking the contrast. This was a well-diagnosed case, and
कब से चालू हुआ ये वाला आपको?
2012 में.
And she got treated and cured with a Silesia 05. And with the follow-up, if you can see this report, CT cisternography reveals no significant abnormality from the same diagnostic center.
इस बार आपका जो हमने बाल लगाया 18/8 को,
It was Silesia
उससे कितने दिन के
05.
बाद से आपका प्रॉब्लम हुआ?
सीधे डॉक्टर
So the same day
दोपहर यहाँ आए थे.
I am going to explain further in my next slides. This is another case from very recent case from the 24th March. You can see, and this was a well-diagnosed case, and this case was also getting cured or better by this Silesia.
Hello, sir.
I
Namaskar.
have advised her to take the CT cisternography, but most of the patient what happens that they don't bother to go. for
हमने आपका ट्रीटमेंट जो
painful
स्टार्ट
CT
किया,
scintigraphy.
फिर कितने दिन के बाद से आपका CSF आना बंद हो गया?
Just after 6 days.
अपना 27 से स्टार्ट हुआ था. 3 तारीख से टोटली बंद हो गया.
And she is
Okay, sir.
fine till date. On the 4th of
कैसी हैं आप?
September.
सर ठीक हूँ.
तो इतना मरा के बता रही ठीक है, कस के बोलिए अच्छा फोन
She got cured and she is doing her
इतनी
job
बड़ी
in the
बीमारी
bank.
से आप निजात पा रही हैं, CSF Rhinorrhea जैसे, और
Doctor, 3 minutes.
Yeah, yeah.
तो नाइट में ज्यादा
This
होती
is
है और
another
जैसे
case of from Ujjain. I will finish by 7:30.
आपका जब ट्रीटमेंट चल रहा है
This
उसमें तो
case
एकदम
was
हमेशा
cured by the
आपका
natural
CSF
route. Natural.
जी सर जी.
And I have presented this case live at the
का सैमिनार ऐसा सिखाना रहता है. मैंने इनका ट्रीटमेंट किया, नर्क तो क्या दवाई है पूरी तरह से ठीक हुआ. खास बात क्या है, आज मैं आपके सामने
जी सर जी.
इनका रिसेंट फॉलो है और मैं आपके सामने ये केस लाइव प्रस्तुत कर रहा हूँ. आपके सामने ये पहली बार आपके सामने ये पेशेंट इंदौर में आई है मुझसे मिलने. ये पेशेंट आपके सामने ट्रांसलेट कर दिया.
Live at the hospital seminar. So this was a case. I have already told you that I have cases of different type from the brain tumor as well. This was a case from the pituitary
Yes.
macroadenoma, and you can recognize the
How
feature
are
of
you?
the pituitary macroadenoma, the
I'm fine, sir.
gigantism.
What about your CSF leak?
And she got cured, and this is also a case of from a old lady of the 75 years old lady, and she also got cured with the CSF Rhinorrhea. And
जी
so this is the
जी.
recent follow
बंद कर
up.
लीजिए, कैसी हैं आप?
नहीं हम ठीक हैं.
एकदम
So she got completely cured, and this is the conclusion that homeopathy has been found very effective in the treatment of the CSF Rhinorrhea. What is in the nutshell? What is the most important in all these cases? I have treated all these cases with a very new method. That method is called as medicine transmission through air or sahani care. In this particular method, we don't feed any medicine to any of the patient. We take that particular medicine in a glass vial at our center, and one of the hair of the patient is getting inserted in this particular glass vial, and the patient are getting benefit at their place without eating this medicine. This is called as energy transmission of the medicine. You are seeing I am taking the June follow-up of the different patients, and they are from the far away. Even I have seen patients who never came to my clinic and they are getting cured at the distant place. They are sending their hair. Obviously, we take their full case and insert their hair here in a particularly well selected medicine, and they are getting cured. So this was my short presentation. This is my team.